Statistics say that every week somewhere in the world, a healthy-looking person collapses in the gym, usually because of a heart attack. In the United States, according to the American Heart Association, around 356,000 out-of-hospital cardiac arrests occur a year, and a significant number of these are linked to physical exertion, often in gyms or during running. But what if I told you some simple habits which would take probably 5 minutes of right preparation can significantly reduce the risk of heart attack while you exercise? And that is exactly what we are going to discuss in today's video. Most people think heart attacks only happen to old or unhealthy. But even fit individuals can fall prey, especially if they push their heart too hard or too soon. When you run or use a treadmill, your heart rate spikes. This increases oxygen demand. If your heart arteries are narrowed, even slightly, and you suddenly push too hard, the blood flow can't keep up. This mismatch can lead to myocardial ischemia, or worse, a full-blown heart attack. So here is what you need to do to prevent the risk of heart attack while you exercise. Always warm up first. Warm up before exercise. We all know this, but I have seen many people not properly warming up before doing any physical activity. When you warm up, your heart, your lungs, your muscles, and your entire body itself prepares for the upcoming physical activity. When you do a proper warm-up, say by doing some slow jogging or by doing some dynamic stretches, what happens is your heart rate slowly starts to increase. And automatically, when there is an increased heart rate, there will be more supply of blood happening to your muscles. This increased supply of blood will ensure that more oxygen is supplied to the muscles. More oxygen means more energy. Another physiological change that happens while you warm up is that there will be a slight increase in your body temperature. This slight increase in body temperature will make your joints and muscles more flexible, making it less prone for injuries while you exercise. Skipping a proper warm-up can suddenly force your heart to pump harder. This can trigger arrhythmias or other cardiac events. So, always do at least 5 to 10 minutes of proper warm-up before you do any sort of physical activity. Doesn't matter how easy or how harder the activity is, or how experienced or how beginner you are in doing it. Know your safe heart rate zone. These days, we all use either a smartwatch or other health bands to track our physical activity. These bands or watches track our heart rate, oxygen saturation, energy burned, whatnot, you name it. Regardless of having these fancy gadgets, nobody is really aware of what is the maximum heart rate they can have. So there is a quick formula to calculate what is the maximum heart rate we can have. You probably might know average heart rate of a person, of a healthy individual, is around 72 beats per minute. So to find out the maximum heart rate we can have is by deducting our age from 220. Let me give you an example. Consider my age is 32. So I have to deduct 32 from 220, which is 188. Now, the maximum heart rate that I can have is approximately 85% of this 188, which is around 160. It doesn't mean that I cannot go beyond 160. That would depend on my health and my fitness level. This is a formula that can be generally applied for everybody. If you are a fit and active person, you wouldn't need to deduct 50% from your number that you have got when you deducted your age from 220. Instead of 15, you can probably do 10% deduction from the number. If you are not sure about your fitness level, you stick on to this formula. What is the formula again? 220 minus your age, you get a number, and deduct 15% from that number. Then you would get a number, and that is your maximum heart rate. This calculation will not give you an exact number because there are a lot of variables such as your health, your fitness level, the intensity of the activity that you're going to do, and so on. But this will give you a range at which you should start paying attention onto your heart rate. So whenever you are doing any activity and you see that your heart rate is reaching or crossing this level, your level, pay attention. Probably you will have to either stop or come down a little. Hydrate, but smartly. Applying simple logic, what would happen if we are dehydrated? Our blood will become a little thicker, a little more viscous. Pumping thicker or more viscous blood is of course leaving your heart more job to do. So what should you do here? Drink sufficient amount of water 20 to 30 minutes before you exercise. One common mistake that I have noticed here is people over-drink during the exercise. This is not the right way to do. As I said, drink sufficient amount of water 20 to 30 minutes before exercise, and throughout the exercise, you sip little quantity of water. Another one concept that I want to mention here is about is it better to drink cold water or room temperature water? I do agree that drinking cold water will make us feel more fresh during exercise. However, if I want to choose between cold and room temperature water, which is the healthier option, it will be the room temperature water. So, cold water may feel nice, but drinking too much of it during exercise can actually upset our stomach or even slow hydration. Don't exercise on a full or empty stomach. So what happens when we have a meal? Once the meal is done, the process of digestion will start in our stomach. For the purpose of this digestion, more blood will be sent into our stomach. And what happens when we exercise as soon as we eat? Our body will have to redirect blood to the stomach and also to our muscles. At the same time, if you go to exercise without eating anything for 1 or 2 hours, you would probably feel like you don't have enough energy to do the activity. So what is the best practice we can have here? Have a small meal before 60 to 90 minutes of your exercise. When I say small meal, it can be a banana, it can be some oats, or it can be a smoothie. Listen to your body, not just the machine. So when you exercise, if you are feeling chest tightness, dizziness, breathlessness, or even a shoulder pain, regardless of how little it is, immediately stop the practice. These could be the signs that your body is telling you about a slow blood supply to your heart. Don't push through the pain, stop the practice immediately. Your body is whispering to you through this sign before it screams. Another bonus tip that I want to tell you is about the intake of pre-workout drinks or coffee. It is a usual practice that people take pre-workout drinks or caffeine to get that sudden spike in energy to complete the activity that they are doing. However, if you are already sensitive to these things or is somebody who is having slightly elevated heart rate or blood pressure, stay away from these things. Because taking these things will automatically increase our heart rate, also our blood pressure. And if you are somebody who is already having this blood pressure and heart rate slightly elevated, taking pre-workout drinks or caffeine will take it even further up, which can put you in danger. So, fitness should never come at the cost of your heart or your life. If you like the video, give it a like and share it with one of your friends who works out. Also, don't forget to subscribe to the channel as there are more good information coming your way. Thank you for watching and hopefully I'll see you in the next one.